Okay. The Board of Trustees of the Lamar Consolidated Independent School District is called to order at 6:00 p.m. This is the special board meeting being held on July the 28th of 2020. We have a quorum with all members present except for Mr. Hubenak. We will open the meeting with a moment of silence to observe as you feel appropriate. Okay, please stand and join me for the Pledge of Allegiance and the pledge to the Texas flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, to Texas, one state, under God, one and indivisible. Right. The next item on the agenda is audience to patrons. Mrs. Vosik, do we have anyone who signed up to speak today?
Yes, Madam President. We are now at the portion of the meeting when the board allots time to hear persons who desire to make comments to the board. Persons who wish to speak to the board must sign up to do so as they arrive, and they must indicate the topic about which they wish to speak. No presentation shall exceed 5 minutes. The board will hear the concerns, but the board cannot deliberate, discuss, or make a decision on any subject that is not posted on the agenda. Persons who speak to the board cannot complain about a district officer or employee in open session. Such concerns are heard in closed session after proper posting of the agenda item has occurred. As you come forward, please state your name and your address. Our first speaker is L.J. Edenmeyer.
Good evening. My name is L.J. Edenmeyer, and I am at 2510 Avenue F, Rosenberg, Texas, 77471. Just moved. Good evening, and thank you for hearing me. And those of you who know me are well aware that a filter is not something I was born with and never have truly aspired to. In fact, I can almost guarantee that my principal probably cringed a bit when my name came up. But in learning to develop a filter, there are two things that have become a part of my process: pause and breathe. Some things you need to know about me if you don't. I am a teacher. I teach theater. My passion and personality thrive on human interaction. It is what makes the art I create with my students engrossing and vital. In this time of isolation, arts has been our mental salvation. Not being in person goes against my nature. So when rationale and science counter that, like so many, I am torn. Educational professionals do what we do because it is our passion. We love our kids. We love our fields. We love sharing with our kids, growing our kids, and helping to create the world of tomorrow. We all have concerns about what is next. We all want what is best for our kids. What is best differs. There are parents and educators on both sides of this argument. What I know is, at the end of the day, we are going to need each other for the sake of the kids, so now would be a great time for kindness, to pause and breathe. My campus has a population of students, administrators, faculty, and staff that equals that of my entire hometown of Sweeney, Texas, which is starting this year virtually as an attempt to flatten the curve. These are unprecedented times. There is no playbook. Starting school and going back to normal is not going to solve all of the problems that we are facing. There is no normal, and for some, this disease has already affected their lives. Personally, my husband was diagnosed with COVID-19. His case was considered mild, but the way he felt at the time wasn't mild, and the ramifications on his body have been somewhat debilitating. Our doctor says the stories are common and nobody knows how long this extreme fatigue will last, and his case was mild. Sorry. We have educators who are retiring, looking into retiring early, leaving the profession, all because schools are winding up the test cases for herd immunity. We are literally hearing quotes from government leaders that we should move forward and, quote, see what happens. My question always is, if the statistics everyone is debating were applied directly to the campus that we are a part of, which deaths would be okay with us? Why, when they have names and not a number, does it make a difference? We have seen what works is to limit contact. We, on a large scale, did not do that, and our numbers continue to be erratic at best when not spiking. I know that many are fully aware that what awaits behind those school doors will not be anything remotely resembling normal. Now, it is reflected, in March, we spent 2 weeks revising our curriculum and transforming lessons so we could teach online, many of us with no real experience in online instruction. In April, we were seen as heroes. We turned our profession around practically overnight. Now it is reflected on with disdain, and we are hearing how awful we were at delivering and how it was not rigorous enough. We gave the students educational experiences with kindness and grace. Was it perfect? No. But we have spent our summers taking online training, learning technology, sharing ideas with others across the district, throughout the state, and around the country. We are prepared to step into a virtual classroom with rigor and relevance. We have prepared how best to engage and how to make it an online classroom as vital and engrossing as in person. Whatever decisions you make tonight is not going to make everyone happy. It can't. We all know that. I am a teacher, I love what I do, and I miss my kids. If your decision is to allow students back on campus day one, I, like many others, will be right there doing everything we can to protect those kids, to teach them. We will do everything in our power to keep everyone safe and cared for because it is what we do. It is our love and it is our passion. So we know these things to be a fact. The virus spreads when people gather in large groups. Some people who get the virus will not survive. Some who survive will have their lives altered indefinitely. Speaking for myself and for others who I have spoken with, for the sake of the health of our students and their families and ourselves.
Greatwood. My wife and I have 2 boys. One will be an 8th grader at Reading Junior High, and the other will be a 6th grader at Poly Ryan. I have a lot of professional experience going to public meetings like this, and this is the part where I'm supposed to say thank you for giving me the opportunity. But frankly, I don't want to be here tonight. This was decided 2 weeks ago, and it doesn't do anyone any good to come back and reconsider what was decided. And I can only guess that we're here because some other elected official not associated with the school board has asked that we come back and reconsider. Let me make 3 points real quick before I get to the heart of my comments. Number 1, this is a serious situation and people have died from it. I don't deny that. My comments are not intended to belittle or disparage anyone's loss, and I don't think this is a hoax. But number 2, in response to the issue of the lack of teachers, I have also taught as a substitute in a Texas school district, not here, but another one. And if you need me to volunteer, just ask, because I want to do the right thing for my kids. I'm not asking anyone to do anything that I wouldn't do myself. Number 3, and this has not been said enough, and people talk about it, but it needs to be repeated. There has not been a single documented case anywhere in the entire world of a student passing this virus on to a teacher. 0. All major medical organizations, including the CDC, are now encouraging schools to open, and frankly, that should be the end of this debate. But here we are. And with that, this is what I would like to say. Our country and our community is in the middle of a widespread panic that is unlike anything any of us have ever seen before. And it's not the virus that's unprecedented, it's the reaction to the virus, it's a panic. Because of partisan politics, over-the-top news, social media, lots of people are frightened, and they've been told that this is a dangerous and existential crisis, and that's just not true. Yes, it is very dangerous to a certain segment of the population, but precautions can be taken to protect those persons. The existing reopening plan you approved 2 weeks ago does a very good job of that. The numbers are very clear that for everyone else, the risk of opening the schools on time is akin to a normal cold and flu season, and that risk is far outweighed by the benefits to our community of getting the kids back in school and ending this ridiculously long spring break. I get it. Some people are very scared, but that fear should not eclipse the benefits of classroom instruction and taking a first step towards normalcy for our kids. You don't need me to tell you this, but I will. By law, this school district is a nonpartisan entity. It is independent of any other local government. You don't have to answer to anyone but the governor. And I'm going to assume that we're here because the county judge has come to you and meddled in your business and asked you and ordered you with powers that he doesn't have, not to follow the detailed and responsible reopening plan that you've already approved. And I don't know if that's happened or not, but I'm going to assume it is because that's why we're here, and you don't have to concede to that request. In fact, the Attorney General clarified today that county officials do not have this power to shut down schools preemptively. Only the school districts do. And assuming we're here to talk about that kind of request, I would like to state for the record that the county judge's motivations for keeping the county and schools shut down are not in line with the best interests of our students. They are in line with the best interests of his party. He has an incentive to keep the panic stoked because scared people don't re-elect incumbents. And this is why school districts in Texas are independent in the first place, so that decisions affecting our children are not driven by partisan politicians. That's why you're independent. If you let him shut you down now, the county will keep extending this order indefinitely, and you will not start school for a very long time because politics never stops. The only way we get out of this hysteria and back to normal is for people to see firsthand that this is not the deadly existential crisis that they have been mendaciously told that it is. The way we get back to normal as quickly as possible is just to get back to normal as quickly as possible. Our school districts are in the unique position of being able to make that happen. All it takes is courage on your part to do it. Thank you.
Thank you.
Our next speaker is Cindy Gifford.
Hello, my name is Cindy Gifford. I live at 3910 Skinner Lane in Richmond. I'm here on behalf of not only a parent of a kindergartner and a first grader, but also as a business owner who works with children. I have decided to keep my kiddos at home, and it's not for the fear that they're going to catch the coronavirus, but it's the unknown of what's going to happen if a lot of teachers get it. Are they going to be out of the classroom for a while? And that unknown for the kiddos to start school out in a negative way, I don't want them to experience that. So I had chosen to keep my kids at home for the first 6 weeks or 9 weeks. But in my practice, I have Kids Resort, and when school was out, I had probably about 15 kids that came in, and we did the Zoom, and we did the online with them. When y'all made y'all's decision a few weeks ago that the parents could choose between going online or in classroom, I had, at the latest count, was 20 kids that have signed up to do with us, to stay with us instead of going to the public school. Depending on what your decision's going to be, as it is today, I have 60-something kiddos in my program. Every one of them will have to be coming to me to stay while their parents are at work. So what my concern is the way that the program is going to be set up. How do we get 60 kids? Some of them are 2, 3 kids in a family, and they're only going to get to use one computer from the school district to make sure that they are getting all of the training that they need. All of the education requirements are being met. Being online with the teachers, doing the Zooms. So something like that, I would hope that if you do decide that you're going to go strictly online, that you take into considerations the daycare centers, programs like mine that are strictly with school-age kiddos, and give us some guidance, too, on how we can make a successful transition for our kiddos. That's all I had to say. Thank you all very much for your time. I appreciate it.
Our next speaker is Laura Erickson.
Hello, my name is Laura Erickson. I live at 8914 Watercrest Trail in Richmond. My apologies, I didn't know until I walked in I was going to speak today. Thank you for letting me come up here. My daughter is going into first grade. She graduated kindergarten last year. I work full-time at HEB, and I'm a single parent, and we struggled. After spring break, we tried to do the online teachings. We didn't do Zoom for her school. I was spending my 2 days off trying to catch up. I was doing 5 days worth of work in 2 days, and she suffered for it. It was too hard, and at this point, I'll have to quit my job if she has to do online school. I don't have another solution, so that means that I'll be living off the government. And even then, I don't know how I'll support my 2 children. I know this is a difficult decision for everyone. I work at HEB. Everyone is still buying groceries. That has not stopped. We deal with COVID every day in what I do, and I come home every day to my children. This is not an easy decision. If there are people out there who are immunocompromised, of course, they don't need to go back to school. But my daughter has to. She needs school. This is a quote from the CDC. Aside from a child's home, no other setting has more influence on a child's health and well-being than their school. In-person school environment does the following: provides educational instruction, supports the development of social and emotional skills, creates a safe environment for learning, addresses nutritional needs, and facilitates physical activity. Those are just some of the reasons that the kids need to go back to school. I don't want to put anyone at risk, but I'm out there every day dealing with it so people can eat and buy their toilet paper, which we do have, by the way. I get to leave work every day so that y'all can buy your groceries. My daughter can't. She's been home for months, and she feels like she has no friends. She's crying. She asked me the other night, why is God doing this? Doesn't he know that some of us don't have the strength to survive this? My daughter is 6 years old. These kids are understanding this more than any of you know. I can't even imagine how she's struggling with this. She just entered school, and it's being taken away from her, and she doesn't understand. So please let her go to school. I'll support you the best I can and whatever you need, but I just want to say thank you, and that's all.
Thank you.
Our next speaker is Kathy Harris.
I'm smiling behind this. Thank you for your time. I'm Kathy Harris. I live at 17 Orchard Falls Drive in Sugar Land. I wanted to start with data. Studies show that the people-to-space density in the average American school is 4 times that of the average American business. In retail businesses, the people-to-space density in a retail business like a grocery store is pretty much the same as the density of people to space in a school. What differs is the interaction time of the workers versus customers in a retail grocery type setting versus the interaction time of teachers with their students, who are our beloved little customers, as well as their family. Keeping those 2 things in mind, the exposure still is great. We discussed this at the last meeting. I do want to say that maybe the conclusion that we want to come to was best stated by Emily Oster. She's an economist at Brown University. She said, bottom line, when schools open, there will be cases. It is necessary to have a concrete plan for what happens. We're not ready, and I want the public to know this is my beloved district. I love it. I'll tell you why later. It's not the fault of this board, the superintendent, or the department heads, the principals or their assistant principals, and most importantly, their super hard, behind the scenes, hardworking staff. They have plans. planned. They are planning. They will continue to plan for the safety of these children and the staff. This should always be our #1 priority. They're planning for the emotional and academic well-being of your children, which must be attended to after their physical safety is attended to. This district is trying to plan in a situation that morphs on a daily basis. The guidance that we get from national organizations, from state organization, changes on a daily basis. It's amazing what school districts are doing in this situation. I want to focus on one thing. Two of the indicators that most school districts or a lot of school districts want to watch is the local positivity rate and the local hospitalization utilization, okay? And that's usually the county health board giving that data to the school boards. I want to discuss this locally. So the organization that would be giving this school district that information is the Fort Bend County Health and Human Services Department. That information is not on their website. I had to call 5 times to get it. I'm wondering if this information is being provided to you, so there's a little shortcoming there. Again, I don't want to bash the people at the Fort Bend County Health and Human Services organization, because they're probably doing the best that they can as well. But that information is not available to the public. You can ask, I have names. What does that mean? It means that we're just not ready, not because of this district. I'm going to sidetrack and say why I love the district so much. This is a small town, big-hearted district that has world-class technology and forward-thinking management vision. I'm so proud to be in Lamar. It makes me want to cry almost. I do want to say this. The last board meeting, we discussed spring teaching, and I was proud again of Lamar. We were told to treat our students with grace. We looked at our students holistically. How are their families going to be able to work at home? Now we know. And my students, y'all should know, I'm busy right now laying out some rigorous work for you all. I'm very proud of our response in March. It was lovely. We need more time. We need 2 plans, a micro plan, how are we going to handle individuals, and a macro plan, how are we going to decide when a campus has to close, when those cases do arise. We have to finalize these plans so that parents can make wise decisions. Please choose to exercise the option to go virtually for the first 4 weeks. Thank you.
Thank you. We are now going to adjourn into closed session pursuant to Texas Government Code Sections 551.071, 551.072, 551.
Yes.
Yeah, she's trying to get, let us get this done, and then we'll,
551.074 and 551.082 for the Open Meetings Act for the following purposes. Okay. The time is now 6:27.
yeah. And she is the, in charge of that organization, and she's the one that penned the letter, and she's here to discuss it, as well as answer any questions from board members. Thank you, Dr. Mentor.
Good evening. Thank you all for having me, and thank you for receiving the letter. As you know, it's one of our jobs is to work with all of the parts of the community to make sure that we're keeping everybody as safe and as healthy as possible. We've enjoyed, I think, a very long partnership and a close partnership with Lamar Consolidated. I've just arrived here, 6 months ago when all of this started, but I know that you all are very familiar with Dr. Kay Reynolds, who's worked with your nursing services and other parts to try to make sure people and children and teachers are very safe here. We at Health and Human Services have obviously been inundated with a lot as far as you know with the virus and just dealing with response. And we've tried to provide a lot of information through different channels. So a lot of the channels are through your nursing channels, your emergency operations channels, and those kind of channels. One of the speakers that spoke earlier did talk about some of the data that we haven't made public facing. And that is a very good point. We haven't been able to make some of the desired data public facing. We have shared some of those details, not only with the letter. I think the letter that I sent personally to each superintendent with different statistics and things that were important, I think, for that school district. And so I tried to make those letters personal about the recommendations to open up some dialogue. In other situations, we had already been dialoguing all along, but I wanted to just kind of send a letter about our thoughts and the things that we're seeing. So one of the things definitely for the school districts that I think you probably know, but just in case you don't, is we absolutely are in favor of face-to-face education for our children. My background is pediatrics. I came to Texas to train at Baylor, at Texas Children's, and we agree very much with the AAP statement about face-to-face instruction. Face-to-face instruction we know is the best for our children. What we do also know is that guidance was given based on what the community disease is looking like at the time. We don't know. This virus is teaching us things all the time, and information is evolving, and it's going to continue to evolve. And one of the best things that any of us can do is to be flexible and have as the best plans we can have in place, because we may need to use them in different ways at different times. We have been working with Trudy Harris, and we've seen your beginning plan or the plan draft that you have, and we've been, Dr. Reynolds has kind of looked through and made sure that she's aware of some of the things that maybe you're not aware of that we've seen, especially when it comes to like daycares, things that we've seen when daycares open. And for us, that's kind of a little clue as to what things may look like when schools open. So as they prepared and had things prepared very well for the opening, their licensing agencies and all of their practices, the CDC guidelines, they were all ready to open up. And when they did, of course, they saw cases. We had enough disease in the community that cases were seen. So we wanted to make sure that we share what we've learned from that about what impact that actually has and what impact that will have on your campuses and the community around. When we spoke to Fort Bend ISD, or when I spoke to Fort Bend ISD, we also had a pediatrician, we had a critical care doctor, we had Houston Methodist vice president, and we had an infectious disease doctor who treats adults. And all of us pretty much had the same take. We want children in school, absolutely. Parents, those of us who have had children go through the public school system, we absolutely want children in school. But we also want it to be safe, and we want it to be as, we know it's going to be interrupted, but we want it to be as smooth and uninterrupted as possible. And sometimes that just takes a little time to step back and make sure everything's in place to get that done well. And so we just want to make sure that we're giving the right guidance, that we're providing you with the information that you need, that we're keeping up as much as we can with that information, with certain things that are going to be helpful, and that we're the resource for you when you need it. We've been walking the halls at some of the public schools and private schools and been giving them guidance as well. So with that, if there are any specific questions, I'm happy to answer them if I can. I
think everybody has a copy of the letter that you sent, correct? And so we were, I was thinking maybe just kind of go through, there's a lot of information to digest in here, so I know you're having to work through a lot of things. And first of all, just thank you for being here. I know you're very busy these days, and so we appreciate, we felt we were going to have a phone call with you. It's even better in person, so we appreciate
down the
being
street.
able to be here. So maybe kind of just working our way through the letter and answering questions so we're not kind of all over the place. And so,
Go ahead,
Oh,
no,
thought you said
no,
something.
move, just moaning
all
away.
right. So the first paragraph, I'll just read it briefly. It says, Dr. Kay Reynolds and I have engaged, this is from you, of course, in preliminary conversations with Ms. Trudy Harris regarding LCISD's plan for reopening schools. Plans for educating your students in a manner that best protects the students, staff, and faculty during the 2021 school year in light of the pandemic are of tremendous importance, as Fort Bend County, along with the entire Houston region, is experiencing an extremely challenging time in our efforts to stem the uncontrolled transmission of COVID-19 in our community. Did anybody have any questions?
Those numbers continue to change.
Absolutely, absolutely.
So from the time you wrote this letter to today, have you seen even a change?
We have. So, and that's the one really good thing, well, good and kind of strange thing with COVID. You can have actions, but you won't see the results of those actions for 10 to 21 days after. So what we're seeing now is the result of the actions that were taken about 21 days ago. The governor had, put an order in place for masking, and then about 14 days ago, we went from kind of orange to red, and people kind of paid a lot of attention to what they were doing. And that's kind of what we were talking about, is that allowed us a chance to kind of step back, see where we were, and maybe say, okay, there's a lot of things we might like to do, and we're not going to get to do them if these numbers go up. The other thing, as you point out, numbers change. I had a lot of questions about our numbers were continuing to go up, but we weren't having deaths. And we weren't necessarily having a lot of hospitalizations. Hospitalization data is really, really difficult to follow. So last time it was really good, well, at Fort Bend ISD, it was good to have Methodist represent, because he could talk about those numbers. But deaths follow the cases, obviously. So we're not going to get all of that at the same time. And we are seeing that trend upwards, and it will trend down as the cases trend down. So yes, it changes all the time.
On that note, I think that for me personally, when I read that it's along with the entire Houston region, for me, I just want to be sure, since Lamar is only in Fort Bend County, that we are not Houston, right? And just making the distinction between,
Sure.
because there's a lot of urban schools there, and we have a lot of suburban schools and rural. So just to me, I think it's just really important that we make sure that we are keeping them separate.
Right, and in the email, so I sent the letter, and I also sent email data that's Fort Bend specific,
Right.
and actually zip code specific. So you can actually see the zip codes that your students are in, that your teachers are in. Certainly that letter, I talk about the Houston region because often we go and travel into Houston. We do things in Houston that may affect our communities. So I talk about the whole region only because disease sometimes doesn't understand the difference, and in some of our school districts, maybe not Lamar, but in some of our school districts, we do have maybe employees that may, live in another district and work out here, or live in another county and work out here. So I mentioned that it's kind of a regional, as opposed to some other part of Texas, where they might not have any cases at all.
Because I know some of our neighboring districts are in multiple counties.
That is
but
true.
We are only in Fort Bend County. We're big, we're 385 square miles, but
Yeah.
we're only in Fort Bend. So
Understood.
I think it's, yeah. Anybody else? Alex?
Question, and thank you for being here.
Sure.
And I watched the discussion that Fort Bend ISD had. That was on July 20th, I believe.
Yes.
And y'all discussed, that was just before this letter, and y'all discussed a little bit about some of the numbers. Now, since then, I follow like the Texas Medical Center's dashboard, Fort Bend County's dashboard, and the numbers seem to be declining. Can you talk a little bit about the conditions on the ground since the 20th, and then this letter in the 23rd, and
Yes.
where we are today?
Right, exactly. So just as I spoke before, we see about 10 to 21 days after changes in behavior or changes in actually it's changes in behavior. Because right now, we're actually seeing, as a public health person, we're actually seeing the response we want to see when certain public health measures are put into place. So when certain public health measures are put into place, we hope that we don't have a vaccine, we don't have medicine, and we still have a lot of disease. So how can we mitigate that? And that's by distancing, by putting on masks. There are just certain things that we do that decrease. So those things started to be put into place early July, and we're seeing the results of that. So if that's your question.
So the numbers are declining in Fort Bend as well, because I see Houston.
Right,
Fort Bend.
right. So we're looking at numbers. I don't have the newest % positivity rate. That'll be calculated sometime today, but we were at 12%, and we're hoping that we're trending downward. I believe in the Houston area they're flattening off, so we're hoping that we'll do the same thing in our area as well. But case numbers, we peak, and then hopefully we start seeing things come down.
What parameters do you use to determine? Because you make a recommendation here, maybe take a few weeks.
Right.
What are the parameters you use to make a decision like that, to make that recommendation? And then on the flip side, what parameters do you use to say, okay, now it's safe to go back?
Excellent question, sure. So the parameters that you use are uncontrolled increases, meaning we're doubling, from week to week, our cases are going up, okay? So that's one of the parameters, and the positivity rate. So uncontrolled spread is anywhere between 8 and above % positivity, and it continues to go up. There are several definitions and several uses. I think the most consistent is under 6%, you've got mitigation, meaning you can control. So if your % positivity is under 6%, then you're controlling in your area. Under 3%, you're actually suppressing disease. So those are some numbers that you want to look at. But if you don't have those exact numbers, what helps you know that you can move a little bit is, are you trending downward, and for how long? So if you're trending downward for 3 days and people get excited, well, their behavior may change, and then that trend doesn't last very long. So you really want to be looking at a 14-day trend. And this isn't anything new. We have all seen this from back even in March and April. The White House gating criteria was 14 days. Why 14 days? It's an incubation period for the virus. It makes a lot of sense. If you're still incubating and yet your numbers are stable and trending downward, that's what you're looking at. So we watch that trajectory of where we're moving. We did have low percentages early. If you recall, even in March and in April, when things were starting to go up, and we did stay-at-home orders, and we got low numbers, and those were great, but we weren't testing as much then, so they didn't really tell us as much. We felt pretty good about them, but they didn't tell us as much. So now, if we have low numbers, those will make us feel better because we've tested so many more people and we continue to test. That means we know that those numbers represent a larger amount of our community and they're more representative.
So, if I can ask this question, if I'm reading between the lines of your letter, you're concerned if school districts open too soon face-to-face, those numbers might spike and go up. Is that what your concern is?
That is the concern, and the concern is it's not necessarily that any and all. So I said in the vast majority of cases, so everybody doing everything at once is the issue. The plans that are well thought out, that are thought about what you would do when you have a case, and how you would address it, and how you handle that are the best plans. And what I've noticed is that when we might go to a small private school, and we know that we can look at the area that they're going to be teaching, and they may have been doing some summer school, and they've thought about things, and things have happened, and they've had certain events. And because they've had those events, they've rearranged their plans and they've done some things, but they're on a tiny scale. They may have 24 kids or 12 kids there that summer. And they've still needed to do certain things, put some things in place to make sure that they're ready to open fully and open gradually to make sure everything is safe. We certainly want people to feel safe when they open. Kids are, you all know this better than I do, kids are resilient. You know, it's the adults that need to help them kind of manage. They take their cues from us. So we want to make sure that we feel like, for as much as this is an unpredictable situation, we still have some knowledge of some things we can do. So making sure we have great things in place, so we have fallback plans, that we have things in place that will help our students and our teachers. Our teachers are sometimes, often some that are nervous and are concerned. So we want to make sure we've got good education for them, good safety protocols, and good plans. If we do have to go to a situation where we're not able to be in school fully. If COVID were the only thing out there, that would be concerning enough. Our immunization rates are down in our clinics, and so we know that they're down in the community in general. We know that flu is going to be an issue. It just always is. We don't know how much of an issue, but it certainly looks like COVID. So there's certain things that we have to consider. All of those things together may play a part in what our fall looks like. So being slow and deliberate and making sure the best laid plans we have are in place is so important. And I know you all know that.
And can you speak a little bit about the effectiveness of masks? I'd like everyone to note that you're not wearing one at the moment, and neither am I, so we're both in compliance. But if let's just take a number randomly, and we don't know at this moment how many of our students want to go virtual and want to go in the classroom. We have a deadline of August the 9th. Let's just say, for instance, 25% of the students want to come back to the school. So if 25% of the students they're all wearing masks, 100% of the students are wearing masks unless they're third grade and below, and all the staff is wearing masks, would that not protect everyone? Because masks seem to be the magic thing that all the politicians are asking society to do. So can you speak about that, walking through a grocery store compared to a school?
Sure. That's a great question. And certainly that shows how things are evolving. Early on, we didn't feel like we would need masks. You remember in March or so, the universal masking was a big issue. They were doing it in some other countries. We didn't feel like we needed it here. Again, disease level has a big difference, and then how close you're going to be at different times. I think a speaker spoke earlier this evening talking about the difference at a grocery store and the difference in a classroom. And of course, that has to do with the level and the extent of time that you're going to be in contact, and how often and how frequently. So having the masks is absolutely a protection, but it's still an exposure if there is a person with disease. We have learned at the county, once we opened and the first level and third level and all of these levels of opening, we have found that we did everything we could to prepare. People felt safe, I think, coming back. But the first case that was in their office, all of a sudden people didn't feel safe. And then they thought, oh, did I have my mask? Did I not have my mask? And, it was just kind of one of those things where we've heard this at multiple workplaces, that this happens. They intend to wear their mask, but they take it off for some other reason. So, this is education. We'll be educating our teachers. We'll be educating our students. If everyone has a mask, they will be exposed if someone is positive, but their risk level will be low as far as getting disease, okay? So the fact that they will get disease would be much, much lower than if they didn't. Reason being, it's primarily droplet spread. Again, we're learning, but it's primarily droplet spread. It is not thought to be aerosolized in a major form right now. They're studying that. But with that droplet spread, the mask does protect those droplets from getting to another person. So that absolutely provides protection, yes.
So in that scenario, if we had 25% of a normal classroom capacity and those children were spread out, and the teacher is more than 6 feet apart from them, that's still not an ideal situation on our first day of school, August 24th. Would that be accurate?
It's like the experiment about to happen, right? Like I was saying with the daycares, so everything is in place for that to happen, right? They had the teachers in the right space. And of course, these children are smaller and they're not masked. But everything is in space, and nobody, to their knowledge, has disease, right? That's kind of what we understand, what we know. But yet, there'll be a case, and then another case, and then people will forget that they did something that they weren't supposed to do. So in the perfect environment, but I'm not sure, no, I am sure that we won't have the perfect environment. And so what you want to do is mitigate those opportunities for that to occur, and also for the fallout of that, right? So I think that one of the things that you all are, of course, challenged with is what happens if teacher A, teacher B, and teacher C. Most likely, they may not get COVID from the school environment, but it's something else that they've been involved in. And as our numbers go down, we relax more, and things may happen just because we've relaxed more and maybe we've relaxed our rules. We're happy for that. We want to do that. But I also think we have learned from our past experience what consequences can come from that. So that remains to be seen. I'm always going to be on the more conservative side because I know that that's where we want to be safest. But I also know there's a balancing act. And we want to make sure that we're balancing on behalf of not only our children, who we've talked about over and over about how they don't seem to spread it and they don't seem to get as ill, but I don't know that we've had enough exposure to really be able to say, we find out more and more the more we're exposed, just like we found out about asymptomatic spread.
I have a question related to one of your answers
Sure.
to Mr. Rolch's question. And you were talking about how the virus spreads, droplets and aerosol.
Mm-hmm.
In our plan right now, it has teachers returning to their classrooms even if they're virtual. So they could be in a safe space, the door closed,
Mm-hmm.
and there might be some concern about it traveling through the HVAC system.
Mm-hmm.
In your opinion, is that possible? Should that be a concern?
So I think that the studies are out. The studies have not borne that out yet, but everything is evolving. And the WHO has just started a massive research study on if that's a major concern. I do believe most of the community, the medical community and the scientific community, believes that if it was a highly significant way of spreading right now with the virus now, we would see a different outcome. So we wouldn't see masks being able to protect us as much. So I do think that as it being a significant concern, we don't know that right now, and is that something that I would think would keep teachers from coming back? If you've got good cycling and good air exchange and all of that, right now with the evidence that we have now, I don't believe that would be that kind of concern. That we just don't have that data that shows us that. We do know things change. We do know information changes, but we don't have information to support a significant spread through aerosol.
Back to the masks. It's been stated that kindergarten through the 3rd grade would not need the masks.
In the classroom.
In the classroom, what makes their age group different from adults and the other kids? Because the adults are the ones coming in, and we really don't know yet their effectiveness of them getting it.
You're correct. You're correct. That's something that we don't know. We may actually find out if we're not masking our little ones. But if our adults are keeping their masks on and they're keeping either a face shield and distance, then we think that they'll be protected. But that's an excellent question. If we don't mask our little bitty ones, and we will find out whether they're sharing. We have the evidence that we have now is that our smaller children do not seem to spread the disease. But we don't have evidence. We will gain our evidence to either support that or to not support that.
Sort of like a trial and error
Yeah.
situation.
We're the guinea pigs.
Well, I don't like that.
I know. That's
the next question I had,
Yeah.
testing, you mentioned the flu.
Mhm.
And we know we've had years where flu literally emptied classrooms.
Yes, yes.
Is there any thought that as we get into the flu season, that there's different testing for flu and a different test for COVID?
So there are rapid tests for flu, absolutely. And so many people in the early stages when we didn't have, we didn't have access to the COVID tests, they would still do the rapid flu just to make sure that people, didn't have flu when they had those symptoms. But yes, the rapid flu will still be there. You will be able to be tested for flu and for COVID, absolutely.
Is that at your request, or will we be actually asking, say the teachers, because they're going to be with the...
So the big push is going to be for flu vaccination. So I think that there's been triple the amount of flu immunizations manufactured by the drug companies, and so we're going to really be pushing that, very much so. But as far as symptoms, a flu and a COVID test are pretty standard. You go, especially with symptoms, you go to your doctor and you think that's what's going on, you're going to get a flu and a COVID, yes.
Is that something you should request?
If you're having symptoms, you're gonna get
I know
right.
a lot of,
But you
nowadays,
can,
they want
yes,
you to go to
absolutely.
COVID. They say go to COVID and be
Right.
tested
Okay, so
first.
I see what you're saying. So at the testing sites, those we're offering COVID. But if you're going to your doctor with flu symptoms, you're going to get a flu and a COVID. Yeah.
Okay.
And you can certainly request that.
And then the next question is the testing results.
Mm-hmm.
Teachers, if they go in, or anyone that has
Right.
thoughts, that 15-minute, or 24-hour test, would we have access to more of that?
So that's part of the planning that we think is essential. Contact tracing and testing. How are you going to do, and we're here to help you with that, both of those, to figure out how you're going to get your test results quickly, get your people in to get tested, and to get the results back. Waiting now, because we've overloaded the healthcare system, waiting 18 days obviously is just, that's not going to work, right? If that were to happen again, you still need a way to get your teachers tested right away and your students tested right away. And so that's part of the planning. There are districts that have actually already contracted with, with testing for on-site, for where they are, not on-site, but on their campuses or on their within their district, so that they can get those results back right away. We're working with Fort Bend ISD right now to develop their plan, and we're assisting. You're part of our community, so absolutely we would be working with that. Contact tracing, because we're overwhelmed, and so there's no way that if you've got things going on your campus, that you're the ones that are going to know, and you're the ones that are going to be able to contact trace them quickly and isolate quickly here. And so the training's available, and I know that Trudy knows about some of those, but the training's available. We can set that up, and then we work in concert with you. So that all goes in the planning.
Picking up on what Ms. Kay was asking, the idea that we're possibly offering our students up as guinea pigs with them. So what would change after the 4-week recommendation or the 8-week recommendation to that same idea?
So that's a good question. You mean about masking for our little
Well,
ones?
just about masking, but going back into a public school setting, because a lot of people are saying you have to do the 4-week delay, you have to do, or the 8-week. I'm trying to understand what the difference would be in September, or in October, or in November, or in January if we delayed it that long. What would be the difference of the risk just to the average student or to the average teacher?
So the more disease that's in your community, the more risk there is. So the longer you're out with the, let's say you get to suppression, the risk to your community, to your teachers, to everyone is lower. If you're down under 3%, you've suppressed disease in your community, and so it's just not going to be as available.
Is that 3% of the general population, or is that 3% of the people being tested?
So it is, but it's absolutely.
Which one?
I'm sorry, it's of the people being tested.
Of the people
But
being tested.
if you're testing enough people, then you can generalize that number to the population. When you're not testing enough people, then that number doesn't have as much value.
Okay. So the second paragraph, you state that the Fort Bend County Health and Human Services shares our desire to have every child receive the best possible education, which you agree that is ultimately means in-person instruction. And so you also mentioned that said this goal does not have to be met on day one, as the process needs to incorporate the flexibility necessary to support the overall health and well-being of the children, adolescents, their families, and communities, as stated in the key principles of the American Academy of Pediatrics. So since we've received your letter, I've read cross-referenced the CDC, I know the American Academy of Pediatrics now. I mean, I've done a lot of reading, and so I have some things to add here and questions. So, since you state that is the best, that y'all agree that it is in person is the best, and you've said that, but it says that the goal does not have to be met on day one to begin in person. So, but a little something from the American Academy of Pediatrics strongly advocates that all policy considerations for the coming school year should start with the goal of having students physically present in school.
Yeah.
The importance of in-person learning is well documented, and there's already evidence of the negative impacts on children because of school closures in the spring of 2020. Lengthy time away from school and associated interruption of supported services often results in social isolation, making it difficult for schools to identify and address important learning deficits, as well as child and adolescent physical or sexual abuse, substance abuse, depression, and suicidal ideation. This in turn places children and adolescents in considerable risk of morbidity and in some cases mortality. Beyond the education impact and social impact of school closures, there has been substantial impact on food security, although I believe LCISD has done a fabulous job of still feeding everybody, and physical activity for children and families. The CDC states that schools are an important part of the infrastructure of communities as they provide safe, supportive learning environments for students, employee teachers, and other staff, and enable parents, guardians, and caregivers to be able to work. Schools also provide critical services that help to mitigate health disparities, such as school meal programs, social, physical, behavioral, and mental health services. School closure disrupts the delivery of these critical services to children and families and places additional economic and psychological stress on families, which can increase the risk for family conflict and violence. The unique and critical role that schools play makes them a priority for opening and remaining opening, enabling students to receive both academic instruction and support as well as critical services. And your paragraph as well, it talks about the flexibility, which we obviously, since we've given an option of online and in-person instruction, we totally agree with flexibility. So I believe that our administration understands the importance of that, and I very much applaud all the work that we have done and the board has approved for the entire year and starting on day one.
Right.
So I just wanted to speak to that.
Sure, and so absolutely, everything in the AAP's guidance, we are in agreement with those statements. I mean, they're
Right.
true.
Yeah.
There is one part, I think, at the end of the key principles that does talk about all of these things needing to be placed in the light of the community disease, the level of transmission in the community at the time you're making the decisions. And I think that's really the capstone. When we look across the country, the American Academy of Pediatrics is speaking to the entire country. And we definitely don't want someone getting the view, and we all know this happens because of what we can see in the media all the time. There are people that will have a 2 or 3% positivity rate and not much disease in their community, and they're still nervous, and they still feel like their children can't come to school. We absolutely know that is what that document is talking about. It is across the country. The disease rates are different. In Texas, they were not the same as they were in New York. They're still not what they were in New York. But we know that people have those fears, and so it's very important to put that kind of guidance out there to let us know that this is where we should be. This is you don't need to be so afraid of doing what is right and best, and your educators want to do that for you. And so I think that's absolutely has scientific basis and is supporting all that we know to do is best in educating the children. But you do need to look at it in light of the current disease transmission. In and I know you're going to go through the letter, but in my letter I also state that we're looking, that those timelines can be changed. Things are just evolving all the time. The flexibility, absolutely. You're offering flexibility for your families, for your teachers, for your community, but we're also talking about overall flexibility if things change within the community, that we all have to be ready to kind of bend and flow. One of the things that we also want to consider is the impact on, on the community as far as if disease does go back up and you've got children that are sick from other reasons. I mean, COVID, although it seems to be taking over everything, there are other things that cause us to be ill. And when I can't get to the doctor or to a hospital because it's full of COVID patients, that has an effect on all of us. So in light of high levels of disease, uncontrolled transmission, that is where the balance tips. But absolutely, total agreement with everything the AAP is saying, and I know that they've given that in their key principles. It's all about the balance, and we want to make sure that we're weighing everything well and that we're flexible enough to change and to flux and to help our students, our families, and our teachers do the same.
And I agree, so I'm glad I feel like it's important, again, to note that we are giving, if somebody gets sick, we're able to pivot quickly online if that does take place, and that's part of our protocols that we've put in place. So I think that's really good. When you said that earlier, when you said there's no medicine for it right now, what do you mean by there's no medicine?
So I mean widely available treatments that make sure that people don't get ill. So let's think about if you've got Tamiflu. So at the early stages of flu, you can give Tamiflu and you can actually mitigate the disease and it won't spread. So that's kind of what I'm speaking about. So widely available medicines at the very beginning. The other thing is that because there's asymptomatic spread with this disease, we don't give medicine to people who aren't showing signs of illness. That's just something we don't generally do right now.
But we have medicine for them if they've tested for it, they have symptoms.
So there are different kinds of medicines. Okay. Yes, there are absolutely different
kinds. When you say there's no medicine, it kind of, I just want to make sure that I understand. And I'm like, oh, what happened here?
So there's no widely available medicines to treat at the early stages. Everybody is not going to get medicine. I can promise you that everybody who has COVID is not going to, is not going to get medicine, even for some of their mild symptoms, because
they may not need it.
They may not need it.
Okay, perfect. Thank you. Anybody else on the flexibility aspect? And so when you say that the healthcare simply cannot keep up right now, what are those numbers based on? Because I've been talking to local hospital directors and whatnot, and I'm getting a different feel for that personally from their numbers. So when you say they can't keep up, what does that mean exactly? Because I feel like they are able to keep up from the information I'm getting.
So healthcare is a large span of different entities. And so I think maybe if you noticed, maybe let's say March, April timeframe, if you wanted to go and get a test, you could go and get a test for COVID and you could get the results back in, a day or 2 days. When people had more symptoms, they were exposed, they were sick, you couldn't get an appointment. People were kind of, it's like, oh, it's taken me 4 days to even get a test, and then the test result doesn't come back in time. So that's overwhelming that part of the healthcare system. That's one part of the healthcare system. If you're speaking about hospitals, at the Fort Bend ISD board meeting, I believe that Chris Siebenahler did speak at that meeting, and numbers change and things change. At that time, he talked about the numbers of patients that were in the hospital. And that evening, they were having to make some decisions about who was going to get an ICU bed and who wasn't. They had actually, at that time, they were having to make decisions. So things flux and things change. And when you overwhelm the healthcare system with the number of disease, it's just what happens. It doesn't mean it's going to be like that forever, but it does mean that we can at times overwhelm the healthcare system, so when we need it, it's not available. There are longer wait times for EMS. That's another portion, because they're getting more calls for different things. And so if there's no room in the ERs, then that backs them up, and they're waiting to let people in to the ER, so that takes them out of circulation, then to pick up somebody else that may have an event that may not even be COVID related. And then if there are beds in the hospital that are still full, then those in the emergency room, which don't get counted in a lot of the numbers, but those in the emergency room then have to stay there. There's no room for them to go to the beds. But it doesn't mean that it stays that way.
And because he was speaking for his hospital, correct? His only hospital?
Correct.
I mean, not in general, in
He
the
was
Fort
speaking,
Bend area?
right, he was
Okay.
speaking for his hospital, but I can tell you that Oak Bend had also, reached out to us about, we have plans for alternate care sites and what happens. They have surge plans about what they do, and Oak Bend has an excellent plan, but they reach out when they start to see those numbers going up and say, oh, do you have something available for us if our numbers get to the point that we can't handle? But they all handled it very beautifully.
Good.
But we're in contact with them. Sometimes the data is, it's not real time. So what they're seeing and what they're seeing at the time, you can talk to them about what they're seeing at the time, and when they're getting to that point, when they're getting concerned, because they put certain plans into place. Doesn't mean that they can't handle it, but they're starting to look at, okay, when might I not be able to handle it? And because you don't want to, just like you're doing now, you don't want to not be prepared.
But we're keeping up. I mean, they're able to still provide quality health.
They
care.
absolutely
Okay.
are.
Okay.
They absolutely are.
Okay. And then, anybody else on that one? Yes.
Well, it's a little different. CDC puts out a lot of guidelines and changes it, I know, every day. Are they above you? You use your guidelines or your protocol? Do you get directions from CDC?
Mhm. Yes, we do.
Okay, so if you had a concern that you haven't had a guideline for here, then you go to the CDC.
So we do. We also talk to the state. A lot of times the CDC, they give global guidelines, and we absolutely use those guidelines. If there's a concern that is not addressed by their guidelines, we can reach out, we can speak with them, we can also speak with our State Department of Health Services and other health departments throughout the country, because sometimes they're dealing with the same things we're dealing with before the CDC has done a general guideline. So that's a good question.
And we kind of touched on the percentages a little bit. And so I have a question about why we use the percentage of positive tests, because again, those can fluctuate how many tests are being done every single day.
Okay, that's a great question.
Right.
So the percentage doesn't have anything to do with the number. It's that percentage is not the absolute number. It's just the percent that's positive, okay? So let's say...
But do you want us to be, you said submissive is 3%, and I listened to the Fort Bend ISD Zoom as well, in full a couple times actually, not in full a couple times, but, so you said that it was 3% was safe to reopen, is what you said in that, and so
I think if I said it that way, what I was trying to say was that 6%, under 6%, shows that you are mitigating disease,
Right.
meaning controlling disease. And 3% or less shows that you're suppressing disease.
And on the thing you said, that's when it's safe to open, is what you said on the, and so my question is, so I understand like one of our sites is not taking insurance anymore. And so I understand if their numbers drop significantly from being tested, I don't know if it was people who are like, my insurance covers that, hey, I'm just gonna go get tested, to I'm really, really feeling bad, I think I should get a test. So I'm curious as to how accurate using those positive percentages is as a determination about the code levels, because versus like, and I'm just asking because why not a hospitalization rate of patients that have come in just for COVID and not have contracted COVID while they're in the hospital?
So very good. It's not one indicator, okay? That's why there's more than one indicator. So percent positive.
3% that you spoke to.
Right, so percent positivity is one of the indicators. Hospitalization rate, another indicator. Even just a downward trend or an upward trend of disease in the community. That's another indicator. Just, more cases in an upward trend or more cases in a downward trend. So these are all, and they're all, you don't take just one. You absolutely look at more than one thing. So, yes.
Okay, so what are the levels, but the 3% you're saying is the percentage of positive tests that have been taken over that week?
So
Of the test of the 3%, or how does that number calculate?
So actually, you look at a trend line, and so each day, there's a percentage of positive tests that day, okay? But you don't base it on one day. You could see one day that something happened at one particular site. I mean, we have, sites all over the county. And you might have 12% on one day, and you had 4% on all the other days. And, as scientists do, we would research what happened there. Why did that happen? And we would kind of look at that. So you would not take one day.
So is it at a week glance? Because that's what we go by is on the greater Houston area. I think
Right.
they go by the week. And so
they look at the 7 days, but when you're making a decision, you're looking at a 14-day period. And you can see things
So
trend,
the
because you're going to
average-
see kind of some ups and downs throughout, but you can see things trend up, as they go up and down, or you can see them trend down. And or you can see them pretty much stay the same over a certain percentage. It might be up 1 or 2 or 3 days, and then down 3 or 4 or 5 days.
So it's over 14-day period.
That's
You take
what
the
you're
average.
That's what you're really looking at.
Okay.
A trend and also an average number. So it's not an exact science. We're still in a new and evolving period, but these are things that have been looked at even with other diseases in the past.
And what's you said the three things is the trend up or down 3%, or the percentage of positive tests, and then the hospitalizations. What do you consider, what's the data that you use to determine hospitalizations, and is it just in the Fort Bend area?
So we use the data from Fort Bend residents, and that's kind of difficult to come by because our Fort Bend residents go into hospitals other places. That's why we're always watching the TMC. Usually the more we have in the Texas Medical Center, the more that we have in the Texas Medical Center, the more we view as sometimes a more severe disease because they've needed to go in there, but then sometimes people just present to the Texas Medical Center. So it's addresses. We also have people in our Fort Bend hospitals that are not Fort Bend residents. So they might be a Brazoria County resident or Matagorda resident or Harris County resident. So we really have to look at the Fort Bend residents.
And so but the hospitalizations, is that somebody that went in and they had only for COVID, they didn't have any other comorbid or any other underlying issues and then they contracted COVID from that, or how do they determine that difference?
So that is determined by their COVID diagnosis and by their disease. A lot of people have underlying diseases. As a matter of fact, that's the vulnerable people that we are trying to protect. However, that person with diabetes that has a chest x-ray consistent with COVID lung disease is still in the hospital for COVID because it's the COVID lung disease that causes them to be in the hospital.
But a lot of them had underlying issues.
Oh, absolutely,
Okay.
absolutely.
Okay. All right, anybody have anything on that? That's good.
I think we got a little way, from the actual school opening.
No, this is all from the letter.
Yeah.
Yeah.
Going back to 10 to 21 days as far as our reporting is behind. Is that correct?
So 10 to 21 days is the time that it takes for us to see the results of what we've done, meaning because of disease onset and when you see the disease actually occur, it takes about 10 to 21 days. So that's not really the reporting, it's more about the disease. But yes, reporting is delayed.
I guess what I'm trying to say is, if we open on the 24th, the information we have is actually going to be behind 21 days as far as
That's true.
what are the statistics for that particular time.
So what people often will do is if you open on the 24th and say on the 28th, there's a huge spike of disease. people get all excited and say, oh, it's because you opened on the 24th. And we know that that's not true. Whatever you see on the 28th is something that occurred before that, okay? 10 to 21 days before that, not on the 24th day that was
So it'd be
open.
like the middle of September before you would be
Exactly.
seeing.
Yeah.
Which would be
whatever-
after like the holiday.
Yeah, yeah.
Which is after Labor Day.
Right,
So
right.
So even
And you-
if we opened later,
Mhm.
if we opened after the holiday,
Mhm.
we would still not have accurate information.
Right, right. I mean, you have accurate information, but it's reflective of the past.
The past.
Yeah.
Okay.
And if the past is good, it's going to be good, right? Like the numbers that we see, if we see great numbers in the coming week, that's going to reflect the things that we did that helped us to get good numbers. It's just the difficulty of dealing with COVID. It's just what it is.
Well, I think what I was trying to figure out is
When?
do we, you say don't start early, but at the same time you suggested we don't have to do everything on day one.
Mhm.
So you're basically recommending that we just do it slowly.
Exactly. Even with and I think that's what we've seen borne out throughout the country. The slower we take to make the changes, because the virus is teaching us things all the time. We do know more, but the slower we take to make those changes and the smaller changes we make, then the effects we can tweak a little bit more. It's just, so you make a really good point.
So by having us open with both face-to-face, if we did open with both face-to-face and virtual, then we are taking it slowly because we're not overpacking the classrooms. And we're trying to manage what we've got. And if we have more kids, and then we're working with them, and then if we see how it goes, then we can, the parents, then we'll see how we're doing. And some of them might say next 9 weeks, we want them in the classroom.
Mhm, mhm.
But then, if you don't put anything in place, you don't have something to show the parents of what you're doing. So you're kind of between a rock and a hard place
Right.
of either going all virtual or, which now we found out we can't do, but just for a few weeks anyway, because we'll lose our funding if we don't go eventually face-to-face. So, we're kind of between, our hands are kind of getting tied, but we need to see if we can try some things slowly. Is that
Sure.
what you're trying to say too?
I am. I think that some of the schools, so I don't know if you all participated, there was a UT School of Public Health webinar back in June that I participated on. It was how do we reopen K through 12? And it was a really, really good webinar. And it did talk about some schools that have done small programs in the summer, those test programs to kind of see if things work or not. So, that's kind of what you're talking about. There are also instances where I think you all have mentioned, or somebody mentioned, there are children that will not be able to have virtual education. So those, you start, sometimes you have to start with some groups at some point. I mean, you all are the ones that know how to be as flexible as possible with the different offerings you have, but you also know, what you had to go through with going all virtual in the past. And I'm sure you learned a lot, and so you could do it if you've gotten in that situation where you had to. But you also know that if the goal is to be face-to-face for every child, you've got to take some steps to get there. So if that's what you're saying.
Yes, that's what I'm saying.
Yeah. When you take those steps and how you take those steps, you want to do it as safely as possible. Again, the difference is the level of disease in the community, and that absolutely changes. Absolutely changes.
I'm good.
You're good? Okay.
Sorry.
I think and one of your other points was, although children who have underlying health conditions are thus greater risk and may face greater challenges, and which is another benefit of us giving them a choice to start online or in person. So I'm thankful for that as well. And then you talk about, it's important to remember that some of their substitutes may not be able to come back, but we do have lots of substitutes that have already signed up, and so I'm thankful to hear about those numbers as well. So, anyways, I don't think, think I have anything. Anybody else? All right.
But
If
thank
you
to-
have other questions, he's got my email, Trudy. Please don't hesitate. Don't hesitate. Email is really, really good. I may not be able to get back with you like immediately, but I really do try. And phone calls are great, usually after 5, if you all can do an after 5, because things are just so busy. But I have no problem. That is part of the job. I learned a lot about what you all are doing and how we can help. You all give me great information. We've had partnerships throughout. So just because your questions may come up the minute I sit down or afterwards, please don't hesitate. Whatever decisions that you choose to make, know that we're responding regardless. And we're here to partner with you, for our community. We're all in this together.
Thank you so much.
Thank you, Dr. Menter. We
Sure.
appreciate you being here. Thank you.
Okay. So is there any further discussion?
I would like to make a motion. Is the time to do that, or?
And what is, she needs to state what her motion is?
To reconsider the going online, virtual, to go virtually for at least the first 2 weeks, versus the decision we made 2 weeks ago to do hybrid, and just have a discussion about that.
Is there a second? Okay. So there's no second, so we will move on to, are there any future agenda items?
I did have some questions. It wasn't on that
Okay,
motion, but
discussion?
just some
Got
further
it.
discussion.
Okay.
I just had some questions for the administration, so I don't know where to address those
Oh,
questions
yes.
to. If that's
They look ready.
Dr. Randall or Dr. Rockwood looks like he's getting up. I wanted to know if you know offhand how many student commitment forms that we've received so far.
Yeah, so right now we've had just under 12,000 parents complete the commitment form, with 58% requesting virtual and 42% requesting on campus. And so specifically, that's the numbers would be 6,851 requesting virtual and 4,924 requesting on campus. And as was shared with the school board and clarified in the notification and on our website, the virtual is an opt-in program. So if a parent does nothing, they would continue with the on-campus model.
Okay. Do you have an idea of what percentage of teachers would volunteer to teach in person?
So I know Dr. Bowen has been working with staff on a staffing subcommittee, and she might be able to touch briefly on that.
We have not specifically polled the teachers to see what their preference is, but we have put out the information about requests for accommodations, and we've had 42 individuals who have requested to teach virtual at this point, but they've not formally been given information about here's the process.
Okay. And those folks are just to clarify, are people with underlying conditions, or what other situations would qualify for that?
So the 42 requests that we currently have are based on individuals that fall under the Americans with Disabilities Act, and based on their disability are asking for a reasonable accommodation.
Do we have any gauge on other employees in the district, on their level of comfort of food service and bus drivers and things like that?
Well, our M&O, Mr. Dundigan, our M&O has been working all summer, and since March. I mean, they've not really had any time off, as has child nutrition, because they were doing the food production. So those staff members have not actually been working remotely. They've been working
So they're pretty
on-site.
comfortable, it sounds like.
They already are, yeah.
Is the only reason that a teacher could request an accommodation and have it granted be if they have some sort of underlying health condition, or if they're pregnant, or, you know, what circumstances could get them granted that accommodation?
Well, so the Americans with Disabilities Act says that an employee, based on their disability and the needs of their disability, can request a reasonable accommodation. That's not a guarantee that they're gonna get the accommodation that they're requesting. There's a process for it. And what happens is when the employee provides that documentation to us, their medical documentation, the request form, we then work with them in what's known as a collaborative process with them, the employee, their supervisor, and a representative from HR to determine if we can't grant that accommodation, what other types of things might we be able to grant that would help mitigate the issue.
I have a couple of questions if you have a minute. Like all of us, I think we've been inundated with lots of emails, text messages, phone calls, a lot of concerns. And I've been taking note. If anyone's listening, I've kept a big record. And it's kind of 50-50 of what our next steps should be. And of the ones that were very concerned about us opening, majority of them are teachers. And I'm just worrying that part of their concern is they haven't had the time yet to be shared with completely by their principals or by the in-services that you're planning on to lower those concerns, because they're nervous. And do you feel like what you're planning in the first 2 weeks, or actually starting next week, will help start to alleviate those concerns? Because I understand, I feel their pain, because they want to be with their kids, but they also want to protect themselves and their families. So I'm hoping that whatever y'all are planning, it's going to lower those concerns.
So first things first, I'll let Dr. Mossage talk about that, but one of the things we did is after we made the decision that we would offer the hybrid model is that principals offered optional Zoom meetings with all their staffs.
Okay.
So that they could come participate and they could kind of share the information about what they knew up to this point. Obviously, we don't have all the answers at once, but share what they knew, and the teachers could opt into that meeting or not. Most had very good responses.
Okay.
And then I'll let Dr. Mossage talk about the training that's coming up.
Thank you for sharing that.
You asked the question, do we feel that with more information, we would have less fear? And I do believe that both our principals, as we continue to roll out more information, they've been very involved in the subcommittee work. We have received some teacher feedback with that, and as we continue to move forward to provide more information, I do feel it's going to alleviate some of the fears amongst our staff.
Because I think all they're doing is they're listening and they're talking with one another, and they're not being able to converse, or if they are, they're not getting all the answers they need. And I just feel like if they could get more answers and kind of lower those fears.
I would encourage them also to communicate with their principal. I know that Dr. Bowen had stated as we began to roll out the plan that we delivered to the board, our beginning plan, all of the principals the next day were ready to do Zoom calls or Zoom meetings with their staff to answer any questions that they currently have. And I know that as we continue to deliver that information, that the same process is going to happen, and then they're going to be communicating and planning for back-to-school development. And so, again, with more information, it will alleviate fears.
So what you're saying, too, is that once they are doing that, they can gather information from the principals can bring them back to you and say, these are some areas that we might not have thought about or covered. And we can get there by giving them, because we're having, 2 weeks of?
Yes, 2 weeks, and I think that was also what Dr. Bowen said, is the new teachers report next week.
Right.
And then you have all teachers reporting, if they're not having to do the opt day on the 7th, they're reporting on the 9th.
Oh.
And so what we are doing is to ensure that time period before school starts is provided to review the plan that we delivered here, and then the subcommittee plans to all of our teachers. Continue to get feedback from our teachers and our staff to determine if there's anything that we may need to adjust so that everybody feels confident in the opening of school, both in an on-campus way and or in a virtual manner as well. And training is a very important portion of that.
So if anybody's listening, get in touch with your principal.
And I would like to say, this document is not necessarily on the website in the PDF form, but all this information is on our website. And I don't know, considering the time that you guys put this together, I don't know of a better plan that could have been put in place, because a lot of the people who are commenting on the message boards online are saying, well, Lamar doesn't have as much detail as this district or that district, but I think people often lose sight that we had a later starting date as well. And so those districts were trying to put some more flesh on this because they had a deadline, and we had a deadline that was pushed back. So again, this was put in place a couple of weeks ago, and it allows a lot of flexibility. And I think that might not be understood completely by some of the staff out there, because I don't know how you guys could have done a better job.
Well, and
considering all the circumstances.
each school is going to have a little bit different of a plan too.
Absolutely. Some of the elementaries in certain part of the districts might be different than a high school in a different part of the district.
Right.
So there's a lot of flexibility built into here, so I commend you guys for that.
I think it's important too, and I've seen the website continue to get updated, but to continue to add more information to that website and to give as much information to parents, because parents have a decision to make, and they've got a few more weeks to do it. And I know that a lot of parents are still waiting on that information before they send in their commitment forms. So we have less than a third of the students have done commitment forms, but I know that a lot of parents that I've spoken to say, I want to see specifics on what the cleaning safeguards are going to be. What's a classroom going to look like? And I know a lot of teachers are waiting for that too, because they don't have that. So I think just providing a lot of robust information and continuing to add to that, and just as you go, add as much information as you can. That's important for teachers and for parents. For me, I'll echo what Ms. Danziger said, and my concern, I think that choice for our students is great. I think that the plan that we have laid out is great. My concern, and it was crystallized in the question that I asked on the 14th, and we didn't have an answer at that time. I'm not sure that we're going to have an answer tonight, but it's that the parents get choice, and I think that's great. But I think that a lot of the teachers don't feel like they have choice. And I think that the lack of information compounds that anxiety that a lot of the teachers have. And it's not because the district isn't working hard, because I know, I see it in action, but that compounds that anxiety. So the question that I had on the 14th, and that I'll ask again tonight, and if you don't know the answer, maybe just let me know when we might be able to get an answer, is would the number of teachers that would volunteer to teach in-person instruction cover the amount of students that we expect to commit to return to in-person instruction? Another way to put that, are there going to be some teachers that are going to be forced to teach in person even though they're not comfortable doing that, and they might not necessarily have an ADA exemption?
So our process at this point is that we've asked for teachers that want to teach virtually, and I'm going to venture to say it may be the other way around. There may be teachers who are teaching virtually, and that may not have been their first choice. But the process is going to be for teachers that want to teach virtually, there's going to be an application process, and then a review of that application and a selection. And then those that don't submit an application will be teaching in the face-to-face or the on-campus format. And so I think we don't have definitive answers. The short answer is we don't have definitive answers because we don't know our student numbers yet. And our student numbers are really going to drive how we utilize our staff for obvious reasons. You've got your kids on campus, you've got to teach them in that on-campus format. But based on the conversations that we've had, and knowing that we're hovering in a little more than 50% mark, I think we may more likely be in a different situation where there are teachers who are going to teach virtually, and that may not have been their first choice, just based on the conversations anecdotally.
You wouldn't have to move them to a different school, would you?
That's not out of the realm of possibilities. It's not our first choice. It's really not. But it was a question that was asked, and in full transparency, I think that's something that may be a consideration. If your numbers at school shift and the staff shifts, you may absolutely have to move them based on need.
So right now, based on what you know, I'm not nailing you down.
Thank you.
It's a change every day.
But you feel pretty good about the fact that with the numbers that we have, that if a teacher is uncomfortable teaching in person, that there should be a spot for them to teach virtually. With the information that we have now, and we're still 2 weeks out.
If our numbers hold true, but as Dr. Rockwood mentioned, virtual is an opt-in, so all of our in may have already opted in, and those that don't may be face-to-face, so that may change the numbers drastically. And I think that's the one thing, our student needs have to drive how we staff.
But I think that one of the things that's going to happen is that our principals are going to start reaching out to those families that have not committed yet and try to answer their questions, but also try to get a response, because that, when you have kids that are going to be going on campus versus virtual, once you make those assignments, they're going to have those teachers, and the only way you can do that is by knowing which kids you're serving. And so I think that that's going to help a little bit, because principals are already, they were asking for this information, and we're going to start updating them weekly? Yes. Weekly, what those numbers are, so that they can start reaching out to their families and asking what choices are they going to make.
Thank you.
And then the principals know which children, the parents might have issues trying to get online or have access to internet, because I think we do have a few like that.
Right, so of those numbers we presented, 68% have clarified they do not need a technology device, and 85% have clarified they do not need an internet hotspot.
Okay.
Just to reiterate for the public, correct me if I'm wrong, but the TEA has set the 2-week deadline for commitment. Is that not correct? That they, the way I understand it, they gave everybody up to the first 2 weeks before the first day of a grading period. So it's not Lamar dragging its feet. We still have almost a month before our first day.
That's correct. So the TEA does not want any district to lock a family into a decision prior to 2 weeks out from their start of school. And then every family must have the option and opportunity to adjust whether they want to remain on a virtual format or an on-campus format as we transition to each grading period. And so that is a directive from the state.
And is that just for the first semester, or is that?
I think that as of right now, this is our plan for the 2021 school year. Until things change, we're going to continue with this plan, yes, ma'am.
And for those families who might be hesitant to make a choice, that they think they're pigeonholed for the first grading period, they can make a decision today and still change it up to August 9th. Is that not true?
That's correct. They can change it up
Okay,
until.
so maybe that would help us get our numbers a little bit higher of people saying definitely one way or the other. But it's not definite until August the 10th.
That's correct.
Up until August the 9th, they can still change.
Even these numbers right now, if a parent had already selected virtual, they can switch to on-campus all the way up until August 9th at 11:59 p.m.
And
And 59 seconds.
And you're going to send out that alert, right?
They can attend for 6 weeks in elementary, 9 weeks in elementary, 6 weeks in high school, and then change. But they can't change in midstream.
Thank you.
I'm good.
I wanted to say too, for anybody that might still be tuning in, that we've gotten a lot of emails, and definitely appreciate the ones that are encouraging and respectful, and though I haven't been able to respond to all of them, I've read them all, and I wanted to just also, on a personal note, share that I have accepted a position in a local school that begins on August 24th as well, so I will be in a classroom as well. So if that means anything to anyone, I just wanted to put that out there, that I can empathize a little bit part-time. So
My last comment on the public information feedback, I love emails. Please do not send me an email, anybody, without putting your name on it, though. And if you want to say something nasty, that's fine, just please put your name on it. And don't try to send anonymous things. I'm not going to read those, and they don't do anything.
yeah, those, like I said, I appreciate the encouraging and the respectful one.
Yes.
But
Even if they disagree.
But we read them all.
Even if they disagree, it's fine.
But we're thankful for all the communication, because it helps. That's all. Anyone else? All right, so now I'm asking if there's any future agenda items.
I think we might want to I would like to readdress our calendar, Fair Day in particular. My understanding is there won't be a fair, there won't be a parade.
That hasn't been decided yet, though.
Well, okay,
What, how?
I guess what I was trying to figure out is, could that be something that we would need to consider as far as adding on an extra day for school, if they would be helpful to them? And it doesn't make sense to have a fair day holiday when there won't be a fair.
I think that if we were going to be addressing the calendar, we need to address the calendar in totality as opposed to identifying a particular day. Because number one, we don't have any control over whether we have it or not. And if we had a conversation about it and changed it, and then they didn't change, it's just like today we just found out that TASA and TASB will not have their conference. And we were getting ready, Karen was just anxiously waiting to get everybody in the right hotel. Well, that changed.
Wake up at 6 a.m.,
And so
right?
I think that it would be more appropriate if we are really tracking along like we should. We probably would like to have that day to kind of adjust if we're not actually involved in parades or anything of that nature.
I think the administration, if they need to come back to us to make any decisions about calendar, they'll bring it back to us.
I mean, and I brought it up, so I.
Right,
Yeah.
we got you.
Anybody else? Okay. Well, then I guess the meeting is adjourned. It is, sorry, 8:48 p.m.